record. And I'm going to let people in.
Morning, everyone. We'll just wait for everyone to be let into the room. Okay, well, welcome to our, I think it's our first collaboration with Social Care Future. So a fantastic session today. We've got some brilliant panelists lined up for you and some fantastic speakers. We want you to share your own experience as well, and feel free to say anything at all that you want to say. Come up with some suggestions. Please tweet. We've got a hashtag of an equal life. So would really, really welcome your views, and also promoting some of the work that we're doing. But I think it's the first time that New Local and Social Care Future have worked together, and really exciting collaboration. I think we're very aligned in our thinking and in our values and in our mission to create better social care for the future, and also to unlock community power within all of our localities across the UK. So a little bit about New Local and then a little bit about Social Care Future as we move on. So New Local is a network, really. It was called the New Local Government Network, but we changed our name last year because increasingly it's not just about local government working differently with local communities. It's about the NHS, it's about housing providers, it's about the police, Department of Work and Pensions. It's everyone, every public servant working differently with local citizens in the local place. So we now call New Local. We've got around about 70 councils who are members, but increasingly getting interest from integrated care systems and NHS organisations and others who just want to think about a different way of unlocking community power within their localities. A couple of years ago, two really clever people, the Chief Exec and Deputy Chief Exec of New Local, Dr. Adam Lent and Jessica Studdert, wrote a paper which they spent about a year researching, and it was called The Community Paradigm. So if you're wanting an introduction to New Local, that's probably the best place to start. And since then, they've revised it and updated it. But it really does set out a vision, a really clear and compelling vision for a different way of working with citizens in local places. It talks about how we've kind of had very much in recent years, a market-driven paradigm. And we saw how that didn't work particularly well in COVID, in the early stages of COVID. And, you know, I've spent a lot of my career looking at how to outsource services and then a couple of years later bring them back in again. So the marketisation of, and particularly relevant to social care, I think, it is no longer a solution on its own. Also, we've got the kind of state paradigms, which has been, you know, ever since for the last 50, 60 years, we've had quite a top-down machine-like way of working. I think Hilary Cottam describes it as a factory model of working with the state, seeing citizens as passive recipients of services, and that's not really a good way of working in the future. It's also not sustainable, my personal view. I do feel that public services need a different model, because at the moment the demand for those services is outstripping the resources available, and we've also seen huge impact with austerity, with funding cuts over the last 10, 11 years. Not a political statement, just a factual statement that there has been a huge decrease in the amount of money available for public services. So with community power, it's very much around trying to unlock the assets that we have in places, whether it's a swimming pool, a park, or whether it's the local people. So I'm obviously now chair of New Local and chair of Bolton NHS Foundation Trust, but I used to be the chief exec at Wigan. Something that we did in Wigan was create something called the Wigan Deal, which is a kind of asset-based approach to working differently with citizens. Not perfect, but we tried. We give it a good go over a 10-year period, and it's still going on, where we basically looked at resourcing communities differently, and we put around 13 million into 500 projects, new projects that were there, the ideas came from local citizens. And lots of it was kind of focused on social care. So many of the things we did, we wouldn't actually be described as social care. They were just fun things to do in the local area. So we funded something called Wigan Warblers, which is still going, which is a singing group for people with chronic obstructive pulmonary disease. Wigan's an ex-mining community, so lots of issues with lung problems, and that basically the Wigan Warblers was a fantastic example of how to fund something that's just fun, that isn't a medicalised model, but it managed to increase lung capacity by around 20%. In some of the people that went singing in pubs. So that's a kind of practical example of things that you can do. We also funded something called, didn't call it a dementia support group, it was called Rugby Memories. Again, Wigan, big rugby town, and Wigan Warriors were really keen to work with us and help to bring the current players and some of the older players together with people who either with or without dementia, to create friendship groups to focus on what people really like to do, the assets and the strengths, and what they loved and enjoyed to do, rather than it being a municipal setting, which is not what anybody wanted to achieve. So I'm now going to introduce, she's much better than me at this stuff, the amazing Anna Severwright, who is convener for Social Care Future. Over to you, Anna.
Hi, good morning. Thanks, Donna. I'm hoping my internet's okay because I keep getting messages that it's unstable. But it's really great to be here this morning and be part of this conversation, because I think it's a really important one that we're having today.
Okay, I think we're now going to have what's described as an intimate conversation, Anna. So can I kick off and just ask you a couple of questions, if that's okay? I mean, can you tell us a bit more about Social Care Futures? Because obviously you've been so heavily steeped in all the great work. Just tell us a bit more about it.
Yeah, so Social Care Future started a few years ago, and we're really an informal movement, not a formal organisation. And it started from a frustration, I guess, that actually a lot of the decisions and conversations about social care were happening without people that on social care being a part of those. But it also became a space for people that did its own little thing, where it shouldn't be, actually, you know, it affects all aspects of people's lives. And we came together and we realized that actually what we needed to do was talk about social care in a different way and give a real vision for what social care should be and what we're aiming for. So we co-produced a vision that we all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us. And that, I guess, is so powerful, because actually it's what everybody would want from their life. It's not about social care. But what we do know is that a lot of people are not experiencing that currently. So I guess we're a space where we try and bring people together to talk about the areas that are doing things differently and how we can increase that, talk about social care in a different way, and then try and influence the system to move towards that vision.
That's fantastic. Thanks, Anna. I mean, what would be really helpful is just to give us a bit of a kind of pen picture of something that you've been through, if you like, something that you've seen where people who use social care weren't involved in the design of it, and it was, you know, and then when they were involved, it was a completely different outcome. Anything that you, from your work, that you could describe to us?
Yeah, I missed. It broke up very slightly, but I think you're asking me about talking about people not being involved in design of social care. I think what we've seen in, like, certainly in the talks about the reform for the white papers and things, the Secretary of State put out a lovely photo of his summit on social care, and actually, again, it was a lot of people who have a lot of really great expertise, but nobody that drew on social care. Us that the councils spend money on services that people don't want. And for me, it's actually, if you involve people with lived experience in the designing of services, actually people don't want services a lot of the time. What we want is a life, and often we're the best place to say what that should look like, and perhaps actually we could design something for our lives that actually would meet our needs better, and in some cases actually for less money. But I do think that the system historically has been quite bad at involving people. So I mean, one thing we did, for example, was we held our own inquiry that was led by people with lived experience, and we came up with 5 key changes that were the things that matter to us, and they're very different to the things that the white paper will concentrate on: workforce, commissioning, call home. They want to be in a community where they belong. They want to share power as equals, more resources better used, and that they want to be able to lead the lives they want to live. So it's those sort of things. And so we're just trying to add that voice into the discussion. And we've done things like the pledge that I think you've taken, where if you're at a conference, you know, actually somebody with lived experience should be speaking at conference as well.
I'm just wondering, Anna, because we can see you looking amazing, but we can only hear you intermittently at the moment. I think it might be your instability of your internet. So could you possibly switch your camera off? It's such a shame, but it's really important that we listen to your voice. So you mentioned those 5 key kind of findings from your inquiry, Anna. Is it possible to just run us through those, if you can recall all 5? I think it's really important that people are here today kind of understand them and can kind of apply them to what they do in their day jobs.
Yeah, so the first one is communities where everyone belongs. And I mean, that's obviously really important for what we're talking about today, but really essential, because I think too often what we find is there's a sense of, once somebody needs services, they're often not, they don't feel like they contribute anymore to the society. And actually it's about saying that we all bring things to community, and we all have an important role to play. The second one is living in the place we call home. Again, people often feel they didn't have a choice over where they lived or who they lived with. And especially with community, if you suddenly have to move, all your connections and your natural sort of support structure are lost in that move. The third one is leading the lives we want to live. It's a basic fundamental, really, that, you know, most people have a choice over what time they get up, what they do that day. But actually, again, as soon as you need some support, a lot of those choices are taken away, or you have to make difficult choices between thinking, I only have 2 hours of support today, so do I want to go to Tesco's, do I want to wash my hair, or do I want to go and see a friend? More resources better used is just that actually we do need more money in social care, absolutely. But we also need to make sure that it's being spent in ways that actually enrich people's well-being, and not just on the same things as we used to spend on. And the final one, which is really important to it all, involves the people that use the services. You won't actually get the best outcomes for anyone, really. Hoping my internet's a bit better now. Can you hear me?
Yeah, it's a lot easier to hear you.
Great.
And hopefully we'll be able to see you again when we do the panel discussion in a moment, Anna. I just wondered about, particularly around the community, because this is very much about community power and social care, this conversation today. Have you seen any brilliant examples of where communities are working together with people who use social care? And there's a kind of I don't know, is there any kind of exemplar places that you can point to, Anna?
Yeah, I mean, I think there are some great places, but I think often where it's happening really well, it's in little pockets almost, because I think when a big area decides that we're going to do community really well, actually it's really difficult for that to happen. I think it's got to come up through the community. But I do also think communities do need some support as well. And there are some lots of different brilliant schemes, and New Local have written about them, and they're all over the place. But I think I heard a brilliant story the other day of an area where they're doing a thing called local area coordination. But really, that's just a fancy way of saying that there's a coordinator in their area that supports people. And a lady was telling her story about how she'd had a really life-changing illness that had left her quite disabled, and she could no longer take a trip to school. and she was just staying in all day, and it really was having a massive impact on her. And the school actually said, oh, there's a coordinator we can refer you to. And this lady went round and just had a cup of tea with her. It wasn't coming in and putting in a service. It was just getting to know her, getting to know her family. And then the really crucial thing was that she was linked up to be able to something she could be a part of and contribute to. So she felt useful to the community, and then she got to know other people and became kind of like this really, you know, a part of and an important part of that community. And through that, she felt like she found herself again. And for me, that just shows that it's about everybody feeling they have a part to play in the community. It's not about coming in and doing to people in the community. I mean, there's lots of other great examples, things like community circles, where it's about the informal support that people have already got in the community. And often there's a lot more going on than certainly than formal services know, but even the individual might be aware, because actually a lot of it happens. You know, it's the neighbour that's keeping an eye on someone, it's the friend that's popping in with shopping. And it's just about supporting people to have those conversations in a different way, to say, okay, how can we strengthen this, what's already there, without needing to go down a sort of formal service route. And I think those sort of models are really exciting to see different ways of trying to support people.
That's brilliant. Thanks, Anna. And Anna's, you're really very vocal on Twitter. I love your tweets. Sometimes a bit controversial, but that's what we like. That's what we like. And I remember you posted something a few months ago now about befriending services. Do you want to expand on what you were saying there?
Yes, this was when a couple of years ago I said at my review that I wanted a few hours more support, so that I could have the practical support that I needed to be able to go out and spend more time doing things with my friends, you know, just basic things like, I don't know, go to cinema or something like that. And the lady was lovely, but she went back to her manager, came back to me and said, my manager says we can refer you to a befriending scheme. And I was actually partly really offended, because I was like, but I have friends. and I just was like, what's going on? You know, I'm a young person in my 30s. Not that when I'm older I'd want a befriending scheme either, to be honest, but it just really missed the point. And I felt like what had happened there was they'd said, oh, she feels socially isolated, we have a pathway for this, we will send her to the befriending scheme, and we've commissioned a befriending scheme, so we need to use it. And they hadn't looked at me and said, oh, actually, if we just gave her 2 hours more with her PA to be able to drive her to places, then she could feel more connected to the connections I already had. And not listening to me and not allowing me to come up with the solutions, but making me fit into a pathway. I mean, I didn't accept the befriending scheme, so I don't know what it was like, but yeah.
I mean, I think that it just exemplifies that, what we're getting wrong, doesn't it, as public services working with you, and just as you say, not listening and not understanding you as a person, and what you like doing, and, you know, getting to go and see your friends and enabling that to happen is definitely what the service you should have been supported with. Or it's not a service really, is it? It's just help, isn't it?
Just a life, I think.
Yeah. Exactly. Yeah. But thank you so much. And I also, you know, you are very vocal on Twitter, but it's brilliant that you are. And, you know, yourself, Martin Rutledge, Neil Crowther, constantly saying about these images. Whenever anybody talks about social care, they mean a care home, don't they? And they have pictures of wrinkly hands, you know, and I think we had a hashtag going at one point, didn't we? No more wrinkly hands. See people as people. So thank you so much, Anna.
Oh, sorry. I think that's really important, though, because I think one of the issues around this work and around community and power is this sense that people who need social care or some support are like vulnerable, and the system almost disempowers people more. And then it becomes very difficult to actually make the changes for yourself that you could make. Don't get me wrong, I'm always going to need some formal support. I'm always going to need some probably paid support to help me, you know, have a shower and get dressed and things like that. But actually, I think those narratives around look after the vulnerable actually almost make people in communities and even more passive. And actually, I think there is something about how we change that narrative to say it's about all of us and we all have things to contribute at whatever stage of life we're at. It will look different, but we're all active members of the community. I'll stop now.
That's perfectly put. Thank you. I think Martin Rutler just posted some positive images for us to use rather than these bloody wrinkly hands that are everywhere. Thanks very much, Martin. Okay, we're going to move on to our panel discussion now. We've got a really fantastic, stellar panel of people, so including Anna, who you've already met, but we've also got Liz Kendall MP, who is the Shadow Minister for Social Care. Welcome, Liz. Great to have you here today. Stephen Chandler, who is the President of the Association of Directors of Adult Social Care, or ADASS for short, and the brilliant Vidhya Alakeson, who is Chief Exec of Power to Change, who are doing some brilliant work with communities and across the whole of the UK. So welcome to everyone. I'm going to kick us off with a question to all of you. We'll start off with Vidhya, if that's okay. What is the role of community power in the future of social care? What do you think, Vidhya?
So I think community power is the foundation stone on which the social care system needs to sit. And actually, if we get it right, it's where we can keep most people. It's where most people want to be. They want to be in their communities, in their homes. And actually, we want to stop that drift up into social care. So what I think community power can enable in the future is a sort of symbiotic relationship with social care, but one which stops people drifting up into formal services and keeps people in their communities. And I think you may be coming to this, Donna, but I'll add it in now anyway. But I think the work that we've done with community businesses, I think there are three things that really make what they do powerful in terms of social care. And the first is that they're inclusive spaces. So you don't get there because you have a diagnosis or a label. You're not referred there. They are free, open kind of places within the community. So people are there in an inclusive way. I think the second thing is that they're rooted in mutuality. So it's not the helped and the helper. It's people are there, supporting each other in different ways, interacting with each other in different ways. And I think the final part is around participation. And Anna mentioned it, this idea that actually you suddenly don't have anything to contribute, which is obviously not the case, that people are able to be there and participate actively as citizens within their communities. And I think if we can have more people sort of living within, shifting from where we think social care is into actually that community space, then we also create a much more sustainable social care system, because actually that drift constantly upwards of services isn't affordable long term either. So I think it's critical for me that community power and social care, or community power is part of the future of social care, is absolutely vital.
That's brilliant. Thanks, very clearly and articulately put, Vidhya. Thank you. Could you say a bit more about what you do as well in the wider sense? Talk a little bit about Power to Change and tell us what you do. People are asking what you do.
Yeah. So Power to Change is an independent trust, and we were set up about 6 years ago to drive forward the growth of community-led businesses. So these are organisations that are rooted in their local communities and trade, so they are businesses in that sense, but they trade for the benefit of their local place and the people within that place. So many of them, it was very similar to what you talked about, Donna, with the singing group. Many of them do things that support people who have additional support needs, but none of them would define themselves as social care. But they are constantly supporting local people in their local communities to live better lives and more active lives and participate as citizens in their communities. But very few of them would see themselves as social care, and almost none of them would get any money from anything that resembles the social care system or the wider NHS system. So that's starting to change at the margins with social prescribing. So some of them are more actively now engaged in social prescribing, but there's the vast majority of them are still doing something which I think you could describe as social care, because it's supporting people within their community. They just wouldn't see themselves as part of any sort of social care system. And I think that's quite important, in that actually what this is about is almost seeing a community safety net for everybody as being the starting point for the public service system. And then on top of that is formal services, rather than seeing formal services as the kind of entirety of the system, would be my sense.
That's brilliant. Thanks, Vidhya. So I think this brings us on to Stephen. Obviously, you've got a role in coordinating, pulling together the many disparate views, I expect, from directors of social care, of adult social care. So what do you think is the role of community power in social care?
Yeah, thank you, Donna. I think firstly, it's important to say that I don't think there are that many disparate views amongst directors. I think directors have a really common view of what our role should be. The challenge for us is being able to exercise that role in the way that we would want, as people have said, either resources, etc. But coming back to the real question you asked, I think communities, like we heard, are the bedrock of society, of which social care is part of society. So for me, helping communities be vibrant places for all of the individuals within it, including those people that may need a little bit of support at times, is critical. So as I get older, or if something should change in my life, that would mean my level of independence isn't what it is. I would like to think and would want my community, I would like to be able to continue to play a part in my community, and my community to provide some of the support that I don't need today, but may need in the future. Not because I expect my community to do that, but I think as communities, that's what we inherently want to do. And COVID, in a way, really brought out and showcased the power of communities. So for me, it's about how do we harness that without it being seen as abdicating the statutory responsibilities that local authorities have, but rather being a way of empowering communities to do even more.
That's great. Thanks very much, Stephen. And is there a kind of a real passion for not pushing this approach, but, you know, really driving this different way of working? Because we heard from Anna earlier on, like quite a bad example, didn't we, of commission services top down, not taking the person's personal views or situation into account. Is that kind of passion building amongst the directors of adult social care?
I think it is, but let's be clear. I think, and this is where sometimes I feel a bit responsible, and at times very, very sad when I leave these conversations, because I've been a director for, well, over 10 years. And in that time, I've been managing ever reducing resources. And in a way, managing reducing resources meant reducing choice for people, not because inherently that's what I want to do, to take things away from people and not help people be the best they possibly can, but because in a way I've felt that's being required of me. But you can look up and down the country to see some really great examples where directors and councils are enabling people within their council areas to do things. You know, you could go to Shropshire, where they've really used making it real as a way of empowering people in their communities to direct how the council is doing it. You could go to Somerset, where they've used community-led support as a way of empowering communities to do that. You could go to Derby to see local area coordination really do that. You could go to Leeds. So there are individual examples of really great community-led initiatives. One of the challenges of us in social care is that unlike the NHS, where they tend to agree a single model and then implement it from the centre and top down, we recognise and value diversity, but sometimes that diversity perhaps backfires on us because people don't. So people often say to me, "Oh yeah, but what happens in Somerset was unique to Somerset. You couldn't scale that nationally." Whereas I firmly believe you can. Okay, it might not be community-led support in the model of Somerset because local area coordination in Derby is slightly different, but it still has the same principles at the heart. People themselves are the most valuable and creative asset we have in communities, and our role as local authorities should be to help people be the best they possibly can.
Absolutely, completely agree. And I really am hoping that they don't decide to put social care into the NHS. That would be a really retrograde step. And that the beauty of social care is it can be reflective and responsive and work in partnership with the different views of local people. So thanks very much, Stephen. Then I'm going to move on to Liz Kendall, Shadow Minister for Social Care, and we're really looking forward to what you've got to say today, Liz, and particularly if you can focus on what you think the role of community is within the Labour Party's plans for social care.
I mean, Donna, it's absolutely essential. You can't do anything without it, and it was just so lovely to be part of this debate today. But there is a yawning chasm between this and the political debate and the debate in the media. I mean, if you think about the whole discussion when the government came out with its proposals for a NHS and care levy and a cap on care costs, there was literally nothing of any of this. And if you'd said on the Today programme, Nick Robinson had asked you, what do you think about the government's plans for reform and cap on care costs? And you said, oh, well, I believe it's co-productionism. They wouldn't know what you're talking about. And having worked in and around this issue for 20 years now, I was first got involved when I led a project at IPPR called From Welfare to Wellbeing, the Future of Social Care, working with the then president of ADASS, David Bean. We were trying to say it's not just about, helping people get up, washed, dressed and fed, important though that is, it's about a much bigger vision of living a good life. We wouldn't have put it in the same words as, hashtag an equal life, but we were coming 20 years. Now, I have seen things start to change. I've seen it a bit in Leicester, where I think we are working with Social Care Future and others to try and rethink things. There's a bit of this in government thinking, but it's like a little bit of the white paper. At best, we might get a bit about the community and empowerment, as a one of the X number of things going on. Whereas for my mind, you can't enable people to live the life they choose. You can't do it unless they are not just involved, but are co-designing, co-producing, shaping. And the trouble is, and I think this is really important, I constantly think, why is there literally a totally different discussion going on? And I think you've got to get to the bottom of that in order to change it. And I think that is because politicians don't like to give power away. They want to get power. They don't want to give it away. Professionals, many professionals, the essence of their professionalism is they have a unique body of knowledge. That's what makes them a professional. And therefore saying, well, actually, my unique body of knowledge is as important. It sort of negates their very purpose. And then you have the sort of whole mechanism of government, which is, somebody once said to me, it was actually Naomi Eisenstadt who set up Sure Start. She said, politicians think delivering policy is issuing a press statement. Civil servants think it's issuing a circular. And it's only the people on the ground who know it's the nitty-gritty day in, day out. So I think, for me, you can't help people ensure people can live an equal and full and fulfilling life as anybody else, unless community power is at the heart of it. But I think we're nowhere in terms definitely of government policy. And we have got to think about how we change that, because we're going to keep in the same situation unless we make that fundamental change. And that's what I'm interested in. I think that's what my job is to change that.
Fantastic. I absolutely love it. That's brilliant. Really great. Okay, I'm now going to go back to you, Anna, and obviously you've just heard what people, I'd like to get your views on what you've heard.
Sorry, broke up then. I'm going to turn my video off again.
That's
Did you
great.
ask
Thank
me
you.
my views on what I've heard?
Yeah, please.
Yeah, no, I think it's been a really good discussion, and I've been trying to keep up with some of the chat as well, because it's loads of really great points coming up. And I think it brings up a lot of the nitty gritty stuff that actually is the challenge for this, that how do you get large organizations to, what we're talking about here is like the beautifulness of community, which is the kind of informal and the spontaneous, and the way that like we saw things like the mutual aid groups springing up and those kind of things, and the creativity of, and then it meets things like the NHS and social care, and they're very different cultures. And how do you support an area and kind of resource it to come up with its own solutions? And I think some of that is about, as Liz was saying, about that sharing of power. How do you allow some services to relinquish some of their sort of, maybe their red tape and the bureaucracy that maybe they would need to put onto organizations that they worked with, and how do you allow that kind of more creative flow to happen? I don't know, what's my thoughts?
Oh, that's brilliant. Thank you so much, everyone. And we're now going to be asking people to post questions. I think we've already got quite a few already. People have asked questions to the panel in the chat. So I don't know who we want to take first, Katie. Katie, would you like to pose the first question and bring the person in? I think Sean Lockwood, again, another great person on Twitter. Sean, can we unmute Sean to ask her question? Okay, sorry about that. I can't unmute. I can't unmute Sean, and I also I'm on my phone at the moment, so I can't see the questions.
I can. Can you hear me now, Donna?
I can hear you, Sean. Yes.
Right.
Yes.
It got complicated. I'm on my phone too. I'm speaking to somebody with slightly wrinkly hands. As I said in the chat, the question is really how we can really enable and think about and who have physical or cognitive disabilities to keep engaged with our community and to contribute. I think the contribution to feeling, we all need to feel valued no matter how old we are. And I think that feeling valued and having roots to contribution is something that needs a lot of thought. And I'm just interested in the panel's views on that.
That's brilliant. I hope people could hear Sean okay. I'm going to bring in Liz to answer that one.
Sorry, I found that very difficult to hear. Could you just repeat that, Donna?
Yeah, Sean, can you just repeat your question, if that's okay?
Can you hear me now?
Yes, that's better.
Hi, Liz. I was talking to somebody with wrinkly hands. And what I'm really, really interested in is how we can enable older people with physical or cognitive impairments, people living with dementia, people who have the kind of physical disabilities that make mobility tricky. How can we help them stay connected with us, to contribute and feel valued? I think that's got a lot to do with the well-being and the health of older people. So for me, it's an important question.
Is that okay, Liz? Did you get that?
Yes, I did. I mean, if I think about it from the perspective of my my city, which is, you know, that's my actual paid job, so I'm always concerned about starting with my constituents. It has to be by a proper discussion with older people and their families about what they want and need to keep in touch with their communities. Going back to the point that Anna said, you can't determine the services and support that's available without absolutely basing that on what individuals and their families want and need. So it's, in my mind, it's about the actual mindset. And I think somebody put in the chat box, this isn't going to happen unless you actually believe that people can make their own lives better. I think we've got to look at that through every aspect of what's happening. So, for example, on the training of staff, care staff, NHS staff, are the users of services and their families, do they shape the training? Are they involved in it anyway? How can you possibly, I mean, part of us thinks, why is it the professionals seem to be telling people what they want and need? Okay, they're not bad people, but unless you've actually spoken to a person in that situation and their family and understood it, including via your training, you'll never go, that's not where your mindset is going to be. So I think we have to look at everything from how users and their families are integral to shaping training programs across the board, in the services that are provided, and through much more direct and powerful mechanisms. We haven't spoken at all so far about direct payments, personal budgets, and other things like that. You know, I think there's, done properly, they can give huge power and control to people, but we've seen, certainly in recent times, those being constrained, and that's a huge problem. So I think you've got to think of every aspect of what's happening. How are you involving users and families? And it's about changing people's mindsets.
I think that's a really, really interesting point. What do you think, Stephen? Because obviously you're working with all the directors, and what really resonated with me, what Liz just said, was around politicians and professionals kind of holding on to that power. So how do we get them to shift that mindset and think differently about not, moving away from a top-down commissioning mindset?
Yeah, no, I agree with lots of what Liz said. Really great points there. It is an interesting challenge, because when I was a director in my last authority, we really worked to dismantle some of the existing contractual arrangements we had, and empowered communities, invested in communities to do more. And it took quite a time to get people, firstly, to believe that that alternative way of supporting people could deliver a better experience for people, and secondly, that it was going to be, and I'll use this word, it was going to be safe, because invariably in this country, when something goes wrong, the first thing that it appears is, who can we blame? Who can we hold to account? And inevitably they will turn to the director and say, you are the legally accountable person in your system. How did you allow this to happen? So one of the ways that I tried to minimize that risk was to ensure people were involved in the planning, and that people and their families were supportive of what we were doing. We didn't force people into a different model, but it was amazing how quickly, when people saw what was possible, how much they wanted that. I think, sort of been on a road to Damascus in a way of late, where I think we've got to be much louder about the role that people have in communities. So, Sean's question around how do we ensure people can remain active in their communities if they have a cognitive disability, that is, I think we've got to help people remain present in their communities there are some systems that have worked to become dementia-friendly communities, not just a dementia-friendly establishment. And I think we've got to do more about that. I think we've got to help people with disabilities where it perhaps might be obvious that they have a disability, to be confident to be in their communities, whether that's because their disability is obvious. And for those of us that aren't disabled, we have got to ensure we support them in doing that, and deal with the issues when people say, why is that person out? Why aren't they being kept inside? Or when somebody does something that is different and risky. Please don't tweet this, but my capacity sometimes is compromised on a Friday night when I've had maybe a few too many beers. But hopefully on the Monday, people don't say to me, "Sorry, Stephen, you can never go out again." So I think we've got to be much more proportionate in how we support people who need support. But let's not see people who are disabled, who have long-term conditions, who are elderly, as being anything other than fantastic members of our community, who have the same rights as all of us have, and support them in exercising that. And call out when that doesn't happen. So if a council's commissioning a service, a befriending service that it expects everybody to use, no, it's not good enough. If a council's reducing direct payments and buying block contracts, it's not good enough. And just because councils don't have enough money is no longer an excuse for that to continue. So, I haven't yet become unpopular with my director colleagues, but I have been saying increasingly of late, call it out, go to your ADASS, tell him or her this isn't good enough, complain, go to your elected official and say, do you know what's going on? This isn't good enough. My colleagues who are responsible for roads have a mailbag that is massive. My cabinet member has a mailbag that is very small. That's not right. So if it's not good enough, call it out.
That's great. Thanks, Stephen. And we'll support you in that, getting out there as president to challenge some of the bad kind of practice and behaviours. And it's not people's fault, but it's not good, is it? It's not helping people. So I think there is another way. I don't know about you all, but I get a little bit disheartened sometimes when we have these sessions like this and everyone's really chomping at the bit to unlock community power and do things differently and challenge government perception and all the wrinkly hand stuff, and then we just it just peters out. So we've got a great question from Kate in the chat about kind of where do we go from here? How do we get people to do the things that we all, I think, on this call here today know instinctively is the right thing to do, but the whole system is pushing us in a different direction. So Vidhya, can you help us? How can we kind of find a different way and find some optimism in the doom and gloom of current government policy? Again, not political, I think just realistic, as Liz has said.
So I think what's been really interesting to me in the conversation so far is we're still talking about the system. So I think we still see the boundaries of social care as being the social care system. And for me, what this whole agenda is about is sort of breaking out of the sense that there is this boundaried system and embracing a sense that actually what we really need for people to have great lives, whether they need support or not, is that wider sense of the system sort of nestled within community. So I think one thing is to sort of recognize what we're all doing, which is the moment we're in a conversation about social care, we start talking about a system. And actually, I think some of the answer to Sean's question is not about the stuff that is commissioned. It's about working in communities with all of those organizations that people have access to make sure that they are welcoming and understand how to support people with additional needs. So whether for me, that question wasn't really about commissioned services. It was about how to create more welcoming, open, inclusive communities. And that's quite a different job from what needs to happen. But to your question, Donna, I think there's real alliances to be made that could give us all much greater power. So I think it's interesting that there is a whole community here of people who care about social care and want to see social care changed. Over here, in most of the conversations I'm sitting in a kind of community of people that care about community and community power. I don't think our worlds talk to each other enough. And I think we could really do much more if we came together. And I mean, we're hoping to launch, or we will launch at the end of this month with a bunch of other organizations, a whole range of different organizations, and the backing of a number of funders a new campaign that New Local has been very much involved in, called We're Right Here. And it's a campaign for community power. And it's not community power in social care or in climate change or in any other thing. It's for community power in the round, that we think that communities are great authors of their own lives, and we want in all aspects of life, communities to have greater decision-making power and control. And I think we should all be trying to work more together, not in our sector silos, but to really champion community power as part of the answer. Because I'm really interested that whether I'm sitting in a conversation about levelling up or climate change or social care, community and the social fabric of our country is the thing that comes back, that it all comes back to time and time again. And that has been massively eroded over the last 20 years. And we have a real crisis of disconnection that is affecting everything from social care to our ability to deal with climate change, to our ability to tackle profound inequalities that we have in this country. So I think rather than sitting in the hope for me is that rather than sitting in our sort of sector silos, we can kind of come together and really start to champion community power as a much wider answer to some of the challenges that we face as a country, and gain power by working together would be my proposal.
That's brilliant. And I think what you've described is exactly what is needed. And I think very often there are people who are coming at it from a very slightly different perspective, but they don't work together. But I think that what you've described as the, kind of almost like creating a social movement, a compelling and energetic social movement is what we need. I'd like to go back to Liz, if that's okay. What do you think about this whole approach of tying the various strands together, social care?
It's excellent. It's just removing politicians from the equation entirely, which is probably a very good idea, apart from we need to sort out the money. But, this is, it's, and that's not a joke, actually. I mean, I think there is, what happens is, and I don't expect anybody to, I'm not saying this for any pity or sympathy, but what happens is, you go into the House of Commons chamber, someone asks you a question, you provide an answer. You go on the radio, the telly, someone asks you a question, you provide the answer, which is not what this is about. This is about saying people provide the answer. But you see, in the context of politics and the media, that's you avoiding responsibility. So we've got to be very clear about what it is that's the politician's responsibility. And I believe that needs to be about the funding and the resources and accountability, because I think there has to be accountability nationally and locally. But how that happens needs to happen absolutely individually and locally. But it's also about saying, and this is the very, very challenging thing, actually the fundamentally challenging thing that Vidhya's just said, which is, a lot of this, it isn't about social care, the system. This is about lots of other things. But once again, bear with me. The framework will be, well, actually, that's not social care, that's somebody else. Once again, the outside view would be, or the typical political or media view will be, you're avoiding responsibility. So I'm not saying that to elicit sympathy, it's just an understanding of how things work. And therefore, that's a massive shift, But this is the most important thing that needs to change. It's this vision of social care is about enabling people to live an equal life, like the life they choose, like anybody else. And I've always remembered the thing that, I think it was Neil wrote this, Neil Crowther, about how is it that in enabling people to live a life like everybody else has become such a complicated thing. I was talking at a local Labour Party event last night and someone said, but there's such a crisis, it's so dreadful, there's such an emergency, how is anything ever going to change? And I said, we're just saying people need to live a life. We're not actually putting someone on the moon. We're not even developing a fabulous COVID vaccine. I mean, what are we doing here? So, and this change, I mean, I can fight the good fight nationally as best I can, but it absolutely has to be a movement for change, I think, because we won't, if it's left to politicians alone, you give us our task, money, accountability, and we've got to change the framework for everything else.
That's fantastic. Yeah, really good. I think we'll be voting for you to be PM, not just because you've got exactly the right approach. I think brilliant. We've got a question in the chat from Martin Rutledge about the Innovation Fund, and I'm going to ask Anna this one. Obviously, there's been talk about an Innovation Fund as part of the white paper on social care. What do you think it should be spent on, Anna?
Oh, what do I think it should be spent on? I think for me, actually, I wouldn't want to see, if there's an innovation fund, that white paper, this is for X, Y, and Z, that could go to local areas, and then those areas deciding with the community, or even the community saying, actually, what is the thing we need to change here, and how do we want to do it together, so that it could be used to try different things, to try new approaches, to continue in some areas the things we do know are working. Like Stephen said, you know, there are areas that have been doing this sort of stuff, but what I wouldn't want to see, I guess, in the white paper is sort of a list of, these are the innovations that we think are great and we want to see them rolled out everywhere, because I just don't think that kind of prescriptive, I don't think that is innovation. And what I would like is to have to look at the areas that have done things well, and look at what cultures and what enabled those things to happen in those areas, and then to allow areas to bid for some money to do those things, and to try and change the cultures around those things to enable real innovation, to take some risks, to try things differently. That would be my view.
That's brilliant. Thanks, Anna. It's not much to ask, is it, an equal life? And yet, as everyone said, it seems to be so difficult to achieve. We seem to bureaucratize it, make it incredibly complex and difficult, and it is mindset. I think Liz is absolutely spot on. It's mindset. So how do we encourage that mindset amongst politicians and professionals to let go of power and to trust and believe in local people, and for it to be a partnership? I'm going to go back to you, Vidhya, about this. Any fantastic examples that you've seen of this happening in any communities that you've worked with?
Politicians and people professionals letting go, is that the question, Donna?
Yeah.
So I think I can think of two different versions of it. So when I spent about a decade working on personalisation in health and social care, so at the vanguard of things like personal health budgets, moving from social care into the NHS, and it was a huge privilege to support a lot of areas that were trying to implement them. And whilst it was a real challenge for a lot of professionals, I constantly came across professionals who really did get it, that actually people did know what was best for them. People did know how, what they needed to make to get a good life. I think I feel quite sad that actually what's happened in that journey around personalisation has been almost the system in its entirety biting back and actually restricting the power and control that people have had. Because what for me was particularly interesting was that what did people choose when they got power and control? They chose things that helped them live a good life. They chose to go to a choir, or they chose to see friends, or, all of those things that we're talking about are actually what people did. And so I think there are professionals, in my experience of working at that level, there were professionals who really got it and who understood, and we sort of need to give them more voice and power in the system to actually challenge their peers. Because I think what I learned in that context was that me challenging professionals was much less effective than peers challenging peers. And so giving voice to those professionals, I think sort of bigger picture, I see local authorities like Calderdale and many of them that work with New Local do really get this agenda and who are building it in systematically to how they work. So really trying to push power down at the neighbourhood level to community hubs to be part of the resilience. And I think one of the things that's particularly interesting about Calderdale is that when they had the floods a few years ago, that was a real turning point for them, because they realised that the resilience of their place was completely connected to the strength of the community organisations that they had. Because like the pandemic, who was it that stepped up first and who came out first to sort things out? It was the community organisations. Long before the local authority could sort things out, the community organisations were on the ground, feeding people, making sure people were safe. And that was a real turning point in mindset. And I think what I'm slightly sad about, disappointed about, is that the pandemic hasn't been a national sort of turning point of mindset. So I really slightly naively now thought that, you know, having seen the power of community in the first wave, particularly of the pandemic, it was the thing that kept us safe, that helped us to cope with what was a huge turnaround in all of our lives. Government would respond by saying, right, we really need to build this in as a basic fundamental of our national resilience and start to strengthen these organisations for the next crisis, which is definitely coming. And that hasn't happened. And so, but I think there are local authorities like Calderdale that have really got it and who are working in a much more systematic way now with community.
That's brilliant. I think they're doing, so you are right, Calderdale are fantastic, aren't they, Vidhya? And great kind of leadership there, political and managerial, working together with communities. And I think their integrated care system's doing some great stuff, isn't it, in West Yorkshire and Harrogate as well. They've got just seem to have a different approach to community and working in partnership, and quite humble as well, which is what we need.
Yeah.
So thank you so much, Vidhya. I've got a question now for Stephen that's been posted in the chat about the role of, what is the role, Stephen, of frontline social care staff in this community-powered takeover of social care? Because very often I think you find frontline social care staff kind of want to, they can see the broken nature of the system and they want change. What do you think we can do to support them in driving that change forward?
So if I'm honest, the first thing I would say, the role is to step back. Step back and allow people the opportunity to make some of the decisions that we've heard people say they want to make. Some people might interpret that as, oh God, the local authorities wanting to do even less to help people. No, I'm not saying that clearly. What I think we need to do as local authorities is provide the necessary resource, and sometimes that'll be money, sometimes that'll be authority, sometimes that'll be support for communities to play the part that they invariably always want to play. And then for frontline practitioners, it's around how do they become part of that community without becoming the lead in that community. Because I think once the local authority asserts itself or appears to assert itself, unfortunately, we all start to then behave differently. So you know, I've seen little community groups work really effectively, and then you put a local authority worker in there, or you put a local authority badge on it, and people's behaviour changes. You know, so in a way, and you know, when we were doing this in when I was in Somerset, or indeed in Shropshire, the instruction I gave to staff was, your role is to not break the law. Whatever you do, don't break the law. It's also about don't breaking the bank. So don't go, you know, investing large amounts of money in something that is going to come back. But absolutely break the mold. So don't go, you know, it's a bit like personalization. Don't use your personal budget to buy the same stuff that the council would have bought for you, because invariably you're not going to get the real opportunity and creativity that comes with that. So for me, it's about, so as a director, my role is to ensure my social work staff know that they've got to change. They've got to support a different way of working. They've got to ensure that people are at the center, and that their role is to enable people to be, you know, as I said earlier, the best they possibly can. And for me, it's about when people say, yeah, but what happens when something goes wrong, or when risks increase? It's my role to be there to, in a way, step in front of them when those things go wrong, and to support them. And, you know, invariably, you know, if you have that approach and you've been open with your system, when things go wrong, very few people look to blame. What people look to do is to try and understand and build on that. What I would say, I really like the fact that you went to Anna around how to spend the innovation fund, which is great, because that's absolutely what we need is not people like me telling you how to spend the innovation fund, but people like Anna who really understands and knows what it's like. We should not be limited by money. You know, when somebody adds up all of the costs of the various things that have been committed to care cap, care account, workforce innovation fund, etc., you'll suddenly find that the 5.4 billion is suddenly used up. And you think, oh my God, is that it? Well, we didn't start the pandemic by saying we have got 20 billion in order to deal with this pandemic. We started and we spent some money, and there's a lot of questions around whether it was spent rightly and wrongly, but we weren't limited by money. And I think there's a real risk when we start to see some of the figures come out that we think, well, there's no money left for innovation. There's no money left to support change. So let's just continue to make do. No, we've absolutely got to keep arguing. We need the Innovation Fund to help support some of that change. We need to build upon the things that are working. We need to roll them out across the country. So it's not, and I agree with colleagues' comments about not to try and apply the same model, but to find the values, find the success factors, and then so take Calder's success factors, leadership, creativity, investment, and then say to people in Cornwall, these are the factors that made it a success in Calderdale. You interpret them in Cornwall in the way that works for Cornwall and work like that. But you don't say to Cornwall, if you want to come on this transition and transformation journey, you can. But if you don't, it's okay. We've got to say it's not okay for the people living in Cornwall, and I'm not making any judgment about Cornwall, just in case anybody says the president said Cornwall's not the place to go. Absolutely, I'm just using it as an example. You can't allow councils to opt out. And of course, we won't be able to, because the good news is this government's introducing a form of regulation and inspection of social care. And I've seen some really good developments in that area where statements, where the work that TLAP have been doing, where the work that Social Care Futures have been doing are going to be core components of it. So if I was a director who didn't believe in it or didn't want to do it or couldn't afford to do it, I will quickly be found out. So, so directors, there isn't a director who doesn't want to do it. There may be some directors who feel they haven't got the resources or been able to do it. And this is a lever for them to be able to say to their councils, come on, we have to do this, because if we don't do it, when the assurance process starts in 2023, we will be found out.
Fantastic. Really refreshing that, Stephen. Thank you for that. Can I ask you one final cheeky question, if that's okay? Can we have some free places for people who draw on social care at the next ADASS conference?
So we've got NCAS coming up next week or the week after, and I believe we've made an agreement. I don't want to be the person who launches it here, but I believe we've agreed for people with lived experience to be able to play a real part in that. Yeah.
Oh, can I give you a round of applause? I think there's only me can do it because I'm unmuted, but thank you so much. That's amazing. Brilliant. Okay, and final question now, because we're running out of time. This one is for Liz. The badge that Matt Hancock launched, the Care badge, obviously not particularly well timed, but the NHS has got a very clear brand that's really well recognised, isn't it, nationally and internationally. Does social care need its own identity, Liz?
It's a very good question. We definitely don't need a badge. I'm not into badges. That's not my kind of politics. I think it's nobody's fooled by a badge. Anyone could put a badge on. Deeds, not words, and deeds, not badges, as the suffragettes would say. But I do. So I think the need to understand what social care is important. And the reason I say that is we need to convince people who pay their taxes that this is something really important and worthwhile for their money to go on, and that it isn't going on somebody else. It isn't going on somebody else. It's going on them and their community and their friends and neighbours and their mums and dads and perhaps themselves as a family carer. It's all of us. This is in the century of aging. Social care is, it's so different from when the initial welfare state was established post the Second World War. Back then average life expectancy was 63. Now it's 80. 1 in 4 babies are going to live to 100. Plus people with disabilities are thankfully living living longer. This is going to happen to all of us. It's vital to the economy, because if 1 in 3 family carers has to give up work or reduce their hours because they can't get the support they need, the economy will collapse. It's something for all of us. It's like education, the NHS. So I think that there is a need to have a clearer understanding of it, because society is a package, is a deal. You know, you have rights to care and support and help, you know, and you've got responsibilities to contribute. You know, I think that's very important. How do you make that happen? How do you give it an identity? I think there's many on the left who want a sort of what they call a national care service. My view about that is that if what we mean is much clearer national eligibility criteria and standards and better pay terms and conditions for staff, that's all great. But I absolutely do not want social care run by the NHS. And what I really want is a personal care service, not a national one. I mean, and I certainly don't want it run by the man or woman, mostly the man in Whitehall. Can't do it. So I think that it's an easy phrase, but I'm not into slogans either. I'm into reality. So how do we actually get a better understanding of it? Now, I would love for the whole world to be part of this. You know, if they could hear this, people would understand. People aren't stupid. They know it's in their life. But that is something that is my lot, as in politicians. That's our responsibility, is to be explaining and saying what this is and why we've got a different vision. But that is, I'm telling you, still an absolute Everest to climb. I mean, if you think about in the House of Commons, everybody involved in this sector, if you think about in the House of Commons, the number of people who really get social care in this way, I don't mean that stands up and rightly champions paid carers or like who really get this. It's tiny. And again, that's, you know, people like me, my responsibility.
Well, keep going, Liz. We need you. We desperately need you.
Right.
Keep going. Well, thank you so much, everyone. What a fantastic conversation. What a brilliant set of people. We've heard some really refreshing, quite different views, I think, and people have been really, really honest. So thank you so much, everyone, and give you all a nice round of applause. Fantastic panel. I'm hoping we can continue to work together at Social Care Future and New Local. But I'm going to hand over for the closing words to the fantastic Anna.
Oh yeah, thank you, Donna, and thank you, everyone. Hoping my internet's okay at the moment. So just to say that this is the first in this conversation about community power, but also the first in a series about the 5 key changes. So our next session is on the 14th of December. It will be a longer session and looking at a place called home. So we want people to come along and be part of the conversation, be a bit more interactive, in a slightly different format. So you can sign up. I think the link's going to be put in the chat. But thank you everyone for coming on today and starting this conversation, and we'll let you know where we're going next with it all.
That's brilliant. Take care, everyone. Have a good day.